In the following video, we will cover the process of reviewing important provider documentation in OneChart. Prompt review of provider documentation is crucial in caring for and coordinating your patient's care. Knowing the most current information on your patient's condition can help give you a more accurate picture of what's going on with your patient. Provider documentation can be found a few different ways in OneChart. Two common ways include using the documentation list view or notes section from your menu or table of contents. More in-depth instructions on how to use these sections can be found by reviewing the corresponding job aid on Learning Live or by watching the video tutorials through Via Christi's OneChart space on the source. One of the best places to gather background information on what brought your patient to the hospital is the admission history and physical. Consultation notes contain similar information about the patient, but is focused more on a specific concern or condition from a specialist. You can find more detailed information about a patient's disease or condition by reading these specialty-driven notes, such as wound care or diabetes management. Both the H&P and consult notes contain a section called History of Present Illness, or HPI. Information found in this section can give you a brief timeline of events of what led to your patient's admission to the facility. This section may also include events that have occurred during the course of the patient's current stay. The Assessment and Plan section of the provider notes will also give you an idea of what diagnoses the patient is currently being treated or evaluated for, which in turn affect what clinical interventions and assessments you might need to perform for your patient. The provider may also include a summary of what medications or tests they will be ordering for their patient, or if a procedure might be needed. This can give you an idea of what events might occur during your current shift or your patient's visit. The Assessment and Plan sections found in Daily Progress or SOAP notes are also great resources you can use. Progress notes will help you stay current on any clinical changes for your patient and can aid in pinpointing modifications providers have made in your patient's plan of care. This concludes the video on reviewing provider documentation in OneChart.